The World Health Organization says that global COVID-19 cases dropped for the third straight week. However, the WHO is still urging people not to let their guards down, especially with the threat of new variants. To help us understand this development, joining us is infectious disease expert Dr. Benjamin Ko. Good afternoon, Doc Benjamin. Why are we seeing a decline in cases globally? Is this because of lockdowns imposed during the holidays? Is it because of the vaccine rollouts, at least in the West? What is it?
Hello, good afternoon. Yeah, well, what we can see actually is particularly in November and December, we saw a surge in the numbers globally, particularly in the United States, which brought the numbers up to almost 800 plus thousand a day. Currently, we're seeing less than 400,000, and that's a significant drop. And this is secondary to the fact that during the whole holiday season, a lot of the countries, particularly in the West and in the northern parts of the United States, were instituting various forms of lockdowns, and particularly in Europe as well.
Or having said all of that, Doc, are lockdowns enough to keep us on this downward trend? We all know, of course, here in the Philippines, we did have one of the strictest lockdowns. Should we expect the same effect here?
Well, we had one of the longest. As to whether it is really the strictest, I'm not confident in saying that. We've had several types of lockdowns, and our form of lockdown is not similar to the ones that are being instituted in other parts of the world. So I'd say that we have half-baked lockdowns compared to the other parts of the world, where their types of lockdowns will allow also part of their economy to progress at the same time.
I like how you say that, Doc. That's absolutely correct. Now, also here in the country, we are seeing more cases outside the national capital region. Right now, cases are going up in the provinces compared to Metro Manila, which we're seeing at least a flat growth. Or at least it's stagnant. It doesn't seem to be going up or going down drastically. Why is that?
Well, it's similar to the world, no? It's a global effect. Like what the WHO has been saying and what we've observed is that over the past year, there were also moments in almost all countries when the cases have actually declined. And sometimes the governments open up too soon. It's the same thing in the Philippines when you have several local government units, and the local government units open up their economies too soon because it's up to the LGUs to actually decide on how to open up their local economy. Then the tendency is most of the individuals, most of us let our guards down too quickly, and the virus tends to come roaring back. Unfortunately, that's the way it is.
All right, one last question, Doc. We do have vaccines arriving within maybe this month, maybe within the next few months. What should happen once the vaccines are here? Are we able to then, lessen restrictions and movement restrictions and further open up the economy? Is that really the way to go?
Let's keep first things first. I'll keep my fingers crossed. I will wait for the vaccines to arrive, and then we proceed from there. Second is the fact that even though we have the vaccines, we should still make sure that we still observe the health protocols that we have now: distancing, wearing a mask, good ventilation, avoiding a crowd. And that's because it takes quite some time for the vaccines to work. Remember, most of the vaccines that are going to be available have 2 doses. And all of the clinical trial studies show that it is after the second dose wherein their efficacy rates are actually bumped up 2 weeks after the second dose. So even if we start the program this February, that means that the second dose will still be given sometime in March. And it will take 2 weeks after the second dose before there's actually any immunologic response to the vaccine. So it will really take quite some time, and we start with a small population. I think one of the things that I mentioned yesterday in one of the interviews was the fact that I agreed with Professor Guido that the numbers should actually be low. Uh, when I say it should be low, that means that the number of cases we have should not be spiraling upwards. And the very reason for that is that it's easier to handle very low numbers and roll out an immunization program than start with very high numbers, because you don't know now if it is the vaccine that is working, who are we immunizing, and how many of these people will actually get infected. Because if you have too high numbers and there are too many active cases, then it will take a longer time before the vaccination program is going to work.
Right. Quick clarification. In the West, Doc, where they've already started rolling out vaccinations, they seem to have a problem
Yes.
with the second dose, right? So governments are now, or at least officials and health officials, they're now faced with the dilemma of whether or not to prioritize the second boosters for those who've had the first shot, or just giving everyone the first dose muna, 'di ba? Before anything else. Which
Yeah.
would be better? Which one do you agree with more?
Well, I would prioritize giving the two doses, because all the clinical studies show. Uh, see, the thing here is that we are looking at the endpoints of the clinical study, and the endpoints of the clinical studies are the second shot. It's not like we have data from the first vaccine alone, which is what Johnson and Johnson is coming out with. And this is the only vaccine that has the single dose study. But all the other vaccines have two doses, and it has its efficacy studies are actually for the two doses. Um, I'd be very cautious in not giving the second dose, particularly with the circulation of the variants in the community. We all know, and all the vaccine companies have already acquiesced to the fact that um, the vaccine may work yet in the variants for SARS-CoV-2. However, they are not as efficacious.
All right, thank you so
So that would be
much.
a problem.
Yeah, thank you so much, Dr. Benjamin Ko, for all your insights and for your time. Thanks for joining us today.